Did you know that measles cases in the United States have skyrocketed to levels we haven't seen in over 30 years? According to the Centers for Disease Control and Prevention, we're facing the highest number of measles cases since the 1990s. Sadly, this preventable disease is making a dangerous comeback, with over 1,600 confirmed cases already this year. But don't panic just yet. Before you worry, there are simple, effective steps you can take to protect yourself and your family from this highly contagious virus. Now, here are 8 critical facts about the 2025 measles surge that everyone needs to know. 8. The numbers are alarming. Let's start with the facts. The CDC reports that as of October 2025, there are 1,618 confirmed measles cases across the United States. According to CDC data, these cases span 42 jurisdictions and involve 43 separate outbreaks. To put this in perspective, the entire year of 2024 saw only about 285 cases. That's nearly a 6-fold increase in just 1 year. WebMD notes that this surge represents the most significant measles outbreak in decades, affecting communities that haven't seen this disease in years. 7. Spreading in clusters. Here's what makes this surge particularly concerning. About 87% of cases this year are outbreak-associated, meaning they're tied to specific clusters of transmission. According to the CDC, this is up from about 69% in 2024. Simply put, measles isn't just popping up randomly. It's spreading through communities, schools, and close-knit groups where vaccination coverage has dropped. Harvard Health explains that when one person gets measles in an under-vaccinated community, the virus spreads like wildfire through that population. 6. Highly contagious virus. Let's talk about why measles spreads so fast. According to the Mayo Clinic, measles is one of the most contagious viruses known to humans. If you're unvaccinated and exposed to someone with measles, you have up to a 90% chance of getting infected. The virus can live in the air for up to 2 hours after an infected person coughs or sneezes. Cleveland Clinic states that you can catch measles simply by being in a room where an infected person was, even after they've left. On top of that, infected people are contagious for 4 days before the rash appears, spreading the virus before they even know they're sick. 5. Falling vaccination rates. Now here's the root cause. The CDC emphasizes that we need approximately 95% vaccination coverage to maintain herd immunity against measles. Unfortunately, many communities are falling below this threshold. According to public health data, vaccination rates dropped during and after the pandemic years, creating pockets of vulnerability across the country. WebMD reports that vaccine hesitancy and misinformation have contributed significantly to declining immunization rates. When coverage drops below 95%, measles can gain a foothold and spread rapidly through unprotected populations. Recognize any of these warning signs in your community? Think vaccination rates might be low where you live? Keep watching till the end, because we'll share exactly what you can do to protect yourself and stop this outbreak. 4. Who's most at risk? Let's identify who's most vulnerable. According to CDC data, 92% of current measles cases are among people who are unvaccinated or have unknown vaccination status. Children under 5 years old face the highest risk of serious complications. Minnesota recently confirmed 20 measles cases in children, mostly unvaccinated. In South Carolina, more than 150 unvaccinated students were quarantined after exposure in 2 schools, and the outbreak grew to 16 cases. The Mayo Clinic warns that people who haven't received 2 doses of the MMR vaccine remain highly susceptible to infection, regardless of age. 3. Serious complications reported. This isn't just about a rash and fever. According to recent reports, there have been at least 3 confirmed deaths from measles this year, along with numerous hospitalizations. Harvard Health notes that measles complications can include pneumonia, brain inflammation, and can be fatal, particularly in young children and immunocompromised individuals. About 1 in 5 unvaccinated people who get measles will be hospitalized. Cleveland Clinic states that measles can also cause dangerous complications months or even years after infection, including a rare but fatal brain condition called subacute sclerosing panencephalitis. 2. Outbreaks in unlikely places. Where is this happening? According to state health departments, outbreaks are occurring in schools, group homes, and close-knit communities with lower vaccination coverage. The CDC reports that international travel and imported cases continue to spark new chains of transmission. Once measles enters an under-immunized community, it spreads rapidly. WebMD emphasizes that this is happening in places that shouldn't be seeing measles at all, areas where the disease was considered eliminated just years ago. 1. You can stop this. Here's the most important fact. Measles is completely preventable. According to the CDC, the MMR vaccine is approximately 97% effective after 2 doses. If you're not up to date on your vaccinations, talk to your physician immediately about getting the MMR vaccine. For parents, check your children's vaccination records, especially if your community or school has low coverage. The Mayo Clinic recommends that children receive their first MMR dose at 12 to 15 months and the second dose at 4 to 6 years. Additionally, if you develop symptoms like high fever, rash, cough, or runny nose after exposure, call your doctor immediately and mention measles. Early isolation helps stop the spread and protects vulnerable people in your community. Okay, friends, here's your summary. We're facing a measles surge in 2025, the highest in decades. Outbreaks are happening across multiple states, mostly among unvaccinated people. But remember, vaccination works. It protects you, your family, and your community. Which step will you take first? Will you check your vaccine status? Will you make sure your kids are covered? Let us know in the comments section below. If you found this video helpful, give it a like, subscribe for more health updates, and share it with someone who might still have questions about measles. Thanks so much for watching. Stay safe, stay smart,